Hi, I'm Janet Tilden.
And I am Tom Tilden.
Welcome to episode 2 of Bernie Guy, Warren Woman. Today we'll be talking about healthcare. Right now, there are too many people who are uninsured. Every day, 100 Americans die because they don't have healthcare. Also, people are paying too much for healthcare and they're not getting enough in return.
We have over 30 million people who are uninsured, and we have 40 million people in this country who can't afford the insurance that they have.
On day 1 of Elizabeth Warren's presidency, she'll protect people with pre-existing conditions. She'll reverse the Trump administration's sabotage of our healthcare system, and she'll lower costs of key drugs for millions of Americans, including insulin, EpiPens, and HIV drugs. Within the first 100 days of Elizabeth Warren's presidency, she'll give everyone the chance to join a high-quality Medicare for All program. She'll lower the age of eligibility for Medicare from 65 to 50, and tens of millions of Americans will have a chance to get high-quality Medicare coverage at little or no cost to them. The cost will be free for Medicare for All for children under 18 and families who make under double the poverty level. That's about $51,000 a year for a family of 4. By year 3, Elizabeth Warren will push Congress to complete the transition to Medicare for All. That coverage for every person will include vision, hearing, dental, mental health, and long-term care. Despite what some people might say, middle-class taxes won't go up under Elizabeth's plan. Here's how her plan to pay for it works. To cover the cost, we start by taking the money employers are currently required to pay under the Affordable Care Act to private insurance companies and have them pay it towards Medicare instead. The rest of the funding comes from taxes on giant corporations, Wall Street, and the richest 1%. Targeted spending cuts, and cracking down on tax evasion and fraud.
So under Bernie's plan, there's 5 key points. First of all, it's going to be a single health program. Everyone will be covered by the health insurance plan, and it will be administered by the federal government. All will have equal access to all medical services and treatments. Second, it's going to be comprehensive coverage. That means that dental, vision, reproductive health, pharmaceuticals, mental health, and long-term care are all going to be covered. Third, it's going to be free at the point of service. So when you go to the doctor, you go to the hospital, you don't pay anything. No copays, no deductibles, no premiums. Fourth, it's going to be universal coverage, available to everybody, every resident in the country. And finally, it's going to have a jobs program attached to it so that during the transition period of about 5 years, there will be a jobs program to get people who are going to be transitioning out of health insurance and industry jobs into other forms of employment. In addition to that, it will be paid for by raising taxes for the millionaires quite a bit. By taxing unearned income from Wall Street, by imposing a fee on the biggest financial institutions, and by restoring the estate tax. Most of us will see an increase in our taxes. However, when you look at what we spend per year on our health insurance, about $12,000, our taxes will the amount that we pay will go down. So if our taxes go up $1,000 a year, this is a great deal for us. And for most Americans, this will be a great deal. We both had a chance to briefly present our favorite candidates' plans. And we both obviously disagree on who the best candidate is for president. However, we are fundamentally in agreement over how serious this problem is. And regardless of which candidate wins, I'm confident that the problem will be attacked. You know, and as an example of how serious this problem is, Janet has something she wants to talk about, kind of a personal story.
At one of our debate watch parties, the waitress was talking to us, and she said that she had a diagnosis from her doctor that she needed a hysterectomy. She's earning money as a waitress, which is probably less than minimum wage plus tips. And the doctor said her out-of-pocket cost to get a hysterectomy would be $50,000. She was like, there's no way I can afford that. And this is literally a matter of life and death, because if she doesn't get the operation, she could get into cancer and end up dying of cancer. Healthcare is a human right, and that's one thing that both of our candidates agree on.
For sure.
It should not be a profit center. The goal of medical care should not be to make the most profit and to take the most money in. It should be to keep the most people healthy as possible.
Amen.